I invite Mr. Ashit Shah, Business Head, Ultrasound South Asia at GE Healthcare, Business Transformation Leader. Welcome, sir.
Thank you very much. It's a privilege.
I'm very happy to announce that FOGSI with the Wipro GE have actually launched an ambitious project, I should say. We were trying to see how we can utilize the ultrasound. Ultrasound is now like the third eye or the third finger of an OB-GYN, but we can definitely use it to reduce the burden of stillbirth. So we have with us from Wipro GE, Mr. Ashit Shah, who's there today with us, and he will be just telling the partnership of FOGSI and Wipro GE, and we have a full team in place to address this issue of stillbirth, reducing the stillbirth burden in our country. So thank you, friends, and after this, Ananta, we can have Mr. Ashit Shah also to address us for a few minutes. Thank you.
Now I call upon Mr. Ashit Shah, Business Head and Ultrasound South Asia of GE Healthcare. Please, sir.
Thank you very much. Thank you very much, the fellow dignitaries and FOGSI team. It's a privilege to partner with you. It's a proud moment for us. GE Healthcare has been there in the global world for more than 100 years. We are being our entire purpose is to work towards precision health, works towards digitizing healthcare. We want to help you to drive productivity and improve outcomes for patients, and that is done through you. Now, if I see the purpose of FOGSI also, it's about working for betterment of women and child in particular. GE Ultrasound, our entire mission and purpose in the world is drive towards it. And it is with this purpose we were looking at a partner because we felt as a leader in ultrasound, it is our duty to see how we can impact and make some change, meaningful change in our beloved country of India. And that is where our discussion started with Dr. Shantakumari. And I think we are privileged. We heard about her mission, her vision of really impacting meaningful change. And that is where she got us into this entire issue of stillbirth. And that's where when we started doing research, we understood, to be surprising, India, along with Pakistan, Nigeria, and if you are Congo, China, and Ethiopia are accounted for more than half of the stillbirths in India. And as per the WHO guidelines, if you see, around 8 prenatal checkups and 1 ultrasound at 24 weeks of pregnancy can be a fatal change to ensure that we prevent the stillbirth. And if you see accessibility and affordability of ultrasound and overall healthcare also in smaller towns, talukas is really a problem. And that is anyway our mission. I think Dr. Rishima also spoke about how technology in ultrasound can really be a game changer. Major causes and risk factors like hypertension, malfunctions, fetal growth restriction, prematurity, all this can be really detected by ultrasound if done early. And that is where we want to partner with FOGSI. Now, through this initiative, we want to reach certain key states with high stillbirths, and we want to run a pilot for over an year where with a detailed process to manage antenatal checkups for pregnant women. And we want to see how this can impact in eventually resulting in limited the risk in stillbirths. From our side, we will be donating our ultrasound equipments, which will be installed in primary healthcare centers in select states and districts. And we would also train the medical personnel on how do you use these ultrasound systems. And then we will partner with all of you from key specialists from FOGSI team. Which we basically will ensure the required interventions, and we all will together partner for limiting preventable stillbirths. We are eagerly waiting for this pilot to start, and it's a privilege and it's a proud moment for us to run this project along with you. I again thank you on behalf of overall GE and GE Ultrasound for partnering with us and making us a partner in this impactful change. Thank you, Dr. Shantakumari. Thank you, the entire FOGSI team. Thank you very much for the moment.
Thank you, Dr. Ananta. Thank you very much. It was heartening when Dr. Shanta asked me to be a part of this team about stillbirth prevention. I think it's a really very unique project which we haven't done separately as looking at stillbirths and assessing it. There are challenges along with assessing stillbirths, preventing stillbirths, starting with the audits, with the terminology, and about how to go about with it. In this module today, we have tried to highlight some sections of where we can address the issues of stillbirth. And from what we take back here, we like to take this module to certain societies and to have the similar CMEs for awareness among gynecologists. That will be one part of the stillbirth project. There'll be other parts, as Mr. Asit Shah just now said, about taking the ultrasonography machines. We are still in the process of identifying districts where we can take it forward, use FOGSI people to help and make a difference on the ground in the long term for reducing stillbirths and making better obstetric outcomes for women. So it's a really wonderful project. I salute to Dr. Shantakumari to have the vision to do it, and Wipro GE to come forward to partner with FOGSI in this process. And we are all privileged to be a part of it.